Welcome to Motors and Medicine. On today's episode, I'm going to be discussing heart murmurs, what they are, how they develop, what they cause, how they're fixed, and how they can impact you on a daily basis, or if you happen to be, say, an athlete, how it can affect you on a performance basis. And I'm also going to insert a demonstrative video so that you can kind of see the flow of the heart and how things typically work. So first off, what is a heart murmur? Well, to put it in simple terms, a heart murmur is an extra audible sound that the heart makes due to some type of defect in the valves found within the heart. So let's backtrack just a little bit. I'm going to go over just the basic anatomy of the heart and the valves and how the blood flows through it. And like I mentioned, I will insert a video that kind of goes through that same process so that you can kind of visualize it. But first and foremost, the heart is obviously, first and foremost, a striated cardiac muscle, and it's about the size of your fist, and it sits about this location on your chest. And it has 4 chambers in it. 2 small upper chambers that we call atria, and 2 large chambers on the bottom that are called ventricles. And so moving from the right side of the heart to the left side of the heart, I'll start there. So the top right side of the heart, as though you're looking at it in the mirror. Because when somebody examines you, it's going to be the left side of the heart. But I'm going to call it the right side of the heart because that's the anatomical description of how it's given. So on the right side of the heart, moving towards your left shoulder, we'll just think of it that way. On the right side of your heart, you have your top right is your right atria. And that atria or chamber receives blood from the superior and the inferior vena cava. These are large veins that bring unoxygenated blood from the body back into the heart. So that blood empties into the right atria. It's then pumped through a valve called the tricuspid valve. And then that blood that's now in the right ventricle gets pumped out through the pulmonic valve, and it gets pumped to your 2 lungs. And in the lungs, you actually get that blood passes through the capillaries of your lung tissue, and that's where oxygen and carbon dioxide exchange occurs. So you get rid of carbon dioxide and you actually get oxygen, and the blood becomes oxygen rich. Beyond that, the blood returns to the heart via the left atria through 4 pulmonic veins. Now, generally speaking, veins usually carry unoxygenated blood. But in this case, this is where things are a little bit reversed. When blood comes from the lungs back into the heart, it's through the pulmonic veins, and there's 4 of them. So that blood empties into the left atria, and then it gets pumped from the left atria down through the bicuspid valve into the left ventricle. Now, the left ventricle, that's where, what we like to say, that's where the business is done. That's where the money is made. That left ventricle, that's the most vital, important ventricle because it pumps blood to the entire body. That muscle has to work the hardest. It has to pump blood up to your brain, down to your feet, everywhere. Okay, so that part of the muscle of the heart works the hardest, basically. And that's the muscle that gets damaged when people suffer heart attacks and other things. So that's the overview. So now as blood comes into the left ventricle, it gets pumped out through the aortic valve and hits the aorta, and then that's where the blood gets distributed up to the brain and down to the body. That's the general overflow. That's the flow of blood through the heart. Now, what happens with a heart murmur is one of those valves, whether it be the tricuspid, the pulmonic, the bicuspid, or the aortic valve, one of those valves develops a defect. And those defects can come from birth. So it's a congenital defect where the valves, instead of, I'm going to try to demonstrate it here. Valves, when they open like this, and then they're supposed to close nice and tight. What can happen is the valve will open and it'll come like this. And you'll have just a small little opening remaining instead of it being nice and sealed. And that can happen for a number of reasons. One of the most common causes of valvular disorder is developing rheumatic fever from an untreated streptococcal infection. And this used to happen long ago before my time, when I was a child, even before that, when children were very young and would get sick with a sore throat, they would not be taken in to see their doctor to get antibiotics. And when that would happen, in some cases, rare cases, that bacteria that infected the throat would migrate and find its way through the bloodstream into the heart valves. And it would vegetate or kind of stay stuck in those valves, and it would cause an infection within the valve itself. And when that happens, the valve gets damaged and becomes degraded to some degree, and it atrophies, and then it starts to get kind of leaky. And so you get those gaps that start to form on the valves. Instead of being a nice tight fit valve, it's now a leaky valve. And so that leaky valve, when blood is being pumped through it, blood can actually make its way back out, and that can make a certain sound. And then sometimes, and that's the most common valve disorder with, say, rheumatic fever, which is a disease of the heart valves secondary to an untreated strep infection. There are other valve disorders where the valves themselves, through either calcification formation or really bad hypercholesterol disease, can lead to the valves actually hardening, and instead of being nice and flexible and opening and closing as they should, they only open part way. So this creates another type of sound where blood pumps through it, but instead of being a nice open valve, now it's only opening, say, halfway, because the valve itself is hardened with calcium and other deposits, plaque and other things, right? So when that happens, when the valve itself gets damaged from a lot of these issues that happen, the valve itself can become hardened. And when it becomes hardened through disease or infection or whatever it is, the valve itself will not be pliable and will not move as much or open as much. So when blood is pressured through it, blood goes from a place where there's good flow through a narrowing, and then that's what creates an increase in pressure, which makes a loud whooshing sound. So that can also create an issue with valves. So you can either have leaky valves or valves that are just hardened and don't open completely all the way. And so these sounds are what we hear when we're listening to your heart. These are what we call auscultatory sounds, and they're sounds that should not exist. Normally, when you listen to a heart, you should hear a bum bum, like a lub dub. That's it. But if you start hearing all these extra sounds, it's because the valves have something wrong. So next, what do we do to treat these valves? And valve disorders, when they're found when you're a child, they generally get fixed when you're a child. When valve disorders just develop later in life, whether it be through comorbidities like diabetes or high blood pressure, high cholesterol, anything that can lead to the valves becoming less pliable and get damaged, those things have to be considered. Those surgeries happen later on in life. So there's a number of things that can be done. Sometimes valves can get repaired with a donor valve, if you will. And sometimes the valves are replaced with valves from other animals, like pig valves, for example. Sometimes valves can be replaced with mechanical valves. So there's a number of different things that are done to replace and repair the valves. The idea here, though, is to maintain a good flow through the heart so that there's no backlog and so that there's no major resistance going from one chamber to the next. Because When that happens, prolonged leaky valve or prolonged high pressure through a valve, it makes the heart muscle enlarge. And that's one muscle in your body that you don't want enlarging, because an enlarged heart leads to even more leaky valves, which is a big problem. One condition that can occur from, say, either in your youth or even maybe when you're like junior high school age is just enlarged heart disease or cardiomyopathy, where an athlete can just drop dead for some reason or just collapse. And that's where the heart itself over time has just enlarged, and we don't want a heart to enlarge, because when a heart enlarges, literally the valves just kind of spread away from each other and can no longer create a good seal. And so when they open, they're either opening too far and they're not closing all the way, or when they open, they're always open. They're not ever closing completely. So these types of disorders cause major flow and backflow and issues with the heart having to work harder to get that blood where it needs to go. Whether it's the right side of the heart pumping to your lungs or the left side of the heart pumping to your body, in either case, we don't want valves to be dysfunctioning. We don't want valves to be leaky, nor do we want valves to be bound up tight and calcified through damage or infection, where they're not opening all the way, making a lot of resistance, where the heart will work too hard to get the blood through. So now next, how do these issues with valves, how do they affect your performance? Well, on a daily basis, typical symptoms are people will feel either very fatigued quite easily, so you can't do the things that you normally would think you could do. You can't walk very long distances without getting really winded or tired. You certainly can't like walk uphill or jog or run because your valves are leaking and you're just not getting enough oxygen into your blood. And then if you're an athlete, it's just magnified that much worse. So if you're an athlete and you have valve damage from some reason, and now you are trying to pump blood through an athletic heart that should be performing at its best, but for some reason you have this valve that's damaged, whether it be something that you inherited from birth, congenital, or something that happened from an infection that went untreated, like rheumatic fever, untreated strep, or if it was from using drugs or smoking or anything that could have affected the viability or the elasticity of the valve itself. And so now if you're an athlete and you have these damaged valves, now you struggle to be at your optimal performance. You can't run your fastest, you can't have the endurance, you can't have the stamina. Any of those things that exist that you need as an athlete are all compromised when you have a valve disorder. So again, if you happen to be struggling with any of those signs or symptoms of easy fatigue, you just feel winded all the time, it could be a valve that's damaged. And of course, if you even have had an exam where they've heard your valves making a lot of noise, you probably would have had it detected by now, and you would have been sent to either a cardiologist for further examinations, to have maybe an echo, which is a test where it's an ultrasound of your heart to see how the blood is flowing through and how much is leaking backwards or how much is being pressurized going through valves that are damaged. And so if these things have happened in your past, you obviously either have had them detected and then had the repairs that we talked about, like having a valve replaced and so forth. But these are things that are important to recognize. A lot of people just don't get regular checkups. Many people who were children during that era where children who had sore throats and suffered rheumatic fever did not get that treated, and so they later on in life developed rheumatic heart valve disease. So those are things that you should be made aware of. At the end of the day, the idea with the heart is it's a simple pump that has blood flowing through it. You really want that heart to have internally to have excellent blood flow with no back pressure, with no increased resistance. You don't want any of that happening with the heart. You want the heart to be functioning at its most optimal so that your heart can last your entire lifespan. And of course, there are other things that can affect the heart function, and those are things that I briefly mentioned, like a heart attack, and that comes from coronary artery disease, which is a totally different video that we've discussed in the past. But at the end of the day, when it comes to valvular disease, it's something that you just need to be aware of. And if it's something that you've never been diagnosed with, or if you were told, hey, you kind of have a loud valve, definitely get that checked out, because you don't want to have a leaky valve or a valve that's under a lot of pressure and not functioning properly, because you don't want your heart to start enlarging and you have problems down the road. So hopefully this information about heart murmurs and valve disorders was helpful for some of you, and just maybe just a review for some who already know about this. But at the end of the day, just keep in mind that we got to take care of ourselves, and take care of our bodies and our hearts. And please give this video a thumbs up if you appreciated the information. All right, so now I'm going to insert the diagram of blood flow through the heart, just so you can kind of see how it works and see it in kind of like a real image. But I do appreciate all your support. And like I mentioned, please subscribe if you haven't. Hit the thumbs up button. And it doesn't take long to sign up for YouTube if you haven't done so. Which I think is what's necessary to be able to subscribe. I know that there's a lot of people who watch my videos and haven't subscribed. But just please do me a favor, sign up, subscribe, give them thumbs up whenever you get a chance. You can even hit the bell notification to let you know whenever I upload content. But I appreciate all your support. And on the next video, we're going to be getting into back into the cars, possibly another review. But until then, this is Motors and Medicine signing off. Thanks.